Hi everyone, happy Friday. Hope you're having a beautiful, beautiful day. It's gorgeous outside if you're in the shade, but very, very, very hot. Today we're talking about the importance of sticking to your annual checkups and making sure that you are just keeping up to date on your appointments because it's a lot cheaper and healthcare effective if you are able to prevent a disease from happening. It's a lot more expensive and harder to stay healthy once you kind of have been diagnosed with something. So we want to talk about some important health screenings. Today's Instagram setting is the Glenstone Museum in Potomac, Maryland. It is a gorgeous, beautiful, beautiful museum that is on 300 acres of land, just natural outdoor beauty. So here's a little bit of the view. All right. Looks like we've got Chunk Papa joining us, and hopefully we'll get Whitman-Walker in the room shortly. Hey, Corey, how are you?
Hey, good. It looks like you're in a nice, beautiful place.
I'm outside in the nature.
Yes, it's
Um,
gorgeous.
yeah, I'm at this museum in Potomac called Glenstone Museum.
Mm,
It's 300 acres of gorgeous outdoor spaces. I'm looking at a lot of bees and butterflies in front of me. They also have indoor beautiful pieces as well. But if I'm sweaty, it's because I'm literally sitting in the sun.
yeah.
So, yeah.
Yeah, I just came outside from getting some lunch, so I'm definitely feeling the weather. And
The heat.
who told me to wear sweatpants today, but yes, But yeah, so it is definitely hot out. I don't know where, but it's waiting for Whitman-Walker.
Yes. And then we should be good to go.
You
But
want?
in the interim, we can start with our introductions.
Okay, perfect. Okay.
Um, yeah.
Hello. All right, well, I'll go ahead and start. Okay, my name is Corey, and I use he, him as pronouns. During the COVID-19 pandemic, the Milwaukee Community Health Department has expanded its outreach efforts to social media platforms. We cover various topics about HIV and STI, sexual health practices, access to care, social determinants of health, and public health interventions. The community health team is here to educate and support you.
Awesome. And my name is Jewel, and I use she, hers pronouns. And today, Corey and I work to bring educational Instagram lives to this space with Walker's Community Health Team. But today we're going to be talking about preventative healthcare as healthcare. So, just so you know, most health plans do cover a lot of preventative services like shots and screening tests, and they're at no cost to you as the consumer. Looks like we might have Walker here. Let's get them on the stage with us. So yeah, you can get a whole bunch of preventative healthcare services and tests and screenings that at no cost to you, all marketplace or ACA or Affordable Care Act or Obamacare, depending on what you call it. Insurance health plans and many other plans must cover preventative services without charging you a copayment or coinsurance. And this is true even if you haven't met your yearly deductible.
About preventative care. Preventative care is one of the strong healthcare intervention tools that we can use to maintain our health long term. It's easier and most cost effective to prevent poor health from happening than it is to treat disease or pay for long term care needed after a diagnosis. A few more commonly known preventative treatments include blood pressure, diabetes, cholesterol tests, um, many cancer screenings, including mammograms and colonoscopy, counseling on such topics with smoking, losing weight, eating healthfully, treating depression, and reducing alcohol use. Regular well baby and well child visits, routine vaccinations against disease such as measles, polio, and meningitis, counseling, screenings, and vaccines to ensure that healthy pregnancies are healthy, flu shots and other vaccines. Screening and shots for adults include here. So basically, here's a full list as provided by healthcare.gov of preventative screenings and shots for adults. It includes many of the lesser known screenings, but depending on your family's health history, they may be known to you. They include abdominal aortic and aneurysm one-time screening. Oh, I didn't even know that, so I need to get that done. For men of a specific age who's ever smoked, alcohol misuse screening and counseling, aspirin used to prevent cardiovascular disease, colorectal cancer for adults 50 to 59 years with high cardiovascular risk, blood pressure screenings, cholesterol screenings, um, colorectal cancer screenings for adults 45 to 75, depression screenings, diabetes type 2 screenings for adults 40 to 70 who are overweight or obese, the diet counseling for adults at higher risk for chronic disease, fall prevention with exercise and physical therapy, and vitamin D use for adults 65 and over living in a community setting, hepatitis B screening for people at high risk, including people from countries with two or more hepatitis prevalence, and U.S. born people who are not vaccinated as infants, and with at least one parent in their region with 8% or more hepatitis B prevalence. Hepatitis C screening for adults aged 18 through 79. HIV screening for everyone 15 to 65 and other ages as increased risk. PrEP, pre-exposure prophylaxis, HIV prevention medication for HIV negative adults at high risk for getting HIV through sex or injection drug use. Whitman-Walker also does have a PrEP clinic. You can look at our website for that. Immunizations for adults, but please note doses recommended have recommended ages and recommended populations vary. Chickenpox, diphtheria, flu, hepatitis A, hepatitis B, HPV or human papillomavirus, measles, meningococcal, yeah, mumps, whooping cough, pneumococcal, rubella, shingles, tendinitis, lung cancer screenings for adults 50 to 80 at high risk for lung cancer because of their heavy smokers or have quit in the past 15 years, obesity screening and counseling, sexually transmitted infectious STI prevention for adults at higher risk, taking prevention medication for adults 40 to 75 at high risk, syphilis screenings for adults at high risk, tobacco use screening for adults, and cessation interventions for tobacco users, tuberculosis screenings for certain adults without symptoms at high risk.
Mm.
Not
Thanks so much, Corey.
a long list, but
A thorough list. So next up, we've got services for pregnant women or pregnant people or people who may become pregnant. So these screenings include breastfeeding or chest feeding support and counseling from trained providers and access to breastfeeding or chest feeding supplies for pregnant and nursing women and people. Birth control, the FDA's approved contraceptive methods, sterilization procedures, and patient education and counseling as prescribed by a healthcare provider for women or people with reproductive capacity. This does not include abortion drugs, and this does not apply to health plans sponsored by certain exempt religious employers. But definitely, look into your insurance plan and your employer's plan to see what they allow, and depending on what state you're in now, because of Roe versus Wade being overturned. They also offer screening and services for folic acid supplements for women or people who may become pregnant, gestational diabetes screenings for women 24 weeks pregnant or later, or people who may become pregnant who are 24 weeks pregnant or later, and those at high risk of developing gestational diabetes. There's also gonorrhea screening for women at higher risk, hepatitis B screening for pregnant women at their prenatal visit, maternal depression screening for mothers at well baby visits, preeclampsia prevention and screening for pregnant women and people with high blood pressure, RH incompatibility screening for all pregnant women and people, and follow-up testing for women at higher risk, syphilis screening, expanded tobacco intervention and counseling for pregnant women and people who are tobacco users, and urinary tract or other infection screening. And as we've highlighted on many, many Women on Wednesdays, the best way to avoid a urinary tract infection is to wipe from front to back and to be sure to pee after sex. to clear any bacteria out of your urinary tract. So those are also great ways to prevent that. Other covered preventive services for women include bone density screening for all women over the age of 65 or women age 64 and younger that have gone through menopause, breast cancer genetic screening, tests and counseling, or looking for the BRCA gene. This is for women who often might have breast cancer that runs within their family. Breast cancer mammography screenings. That's a screening that I know I'm aging into sooner than later, and I'm so scared because I hear it's very painful in terms of them like squeezing your breast in this machine. That's just not a comfortable experience, but necessary because we want to catch things as early as possible.
Am I,
Uh, routine vaccinations against diseases such as measles, polio, or meningitis, counseling, screening, and vaccines to ensure healthy pregnancies, and then flu shots and other vaccines. So there's a theme of vaccines, y'all.
1 second, I got lost. Oh, here we go. Where am I don't know how I got. Okay, here we go. Coverage for children preventative health services include the following: alcohol, tobacco, and drug use assessments for adolescents, autism screenings for children at 18 and 24 months, behavioral assessments for children ages 0 to 11 months, 1 to 4 years, 5 to 10 years, 11 to 14 years, and 15 to 17 years, Bill Rubin concentration screenings for newborns, blood pressure screenings for children 0 to 11 months, 1 to 4 years, 5 to 10 years, 11 to 14 years, and 15 to 17 years. Blood screenings for newborns, suppression screenings for adolescents beginning routinely at age 12. Developmental screenings for children at age 3. Um, dyslip, dyslipidemia, yeah, screenings for children once between 9 and 11 years and once between 17 and 21 years, and for children at high risk for lipid disorders. Fluoride supplements for children without fluoride in their water source. Fluoride warners for infants and children as soon as teeth are present. Gonorrhea prevention medication for eyes of all newborns. Hearing screenings for all newborns and regular screenings, children and adolescents as recommended by their provider. Somebody say something. Any updates on pox?
Yeah, we'll share some at the very end.
Yes. Okay. Hippoglobinopathies. Yeah, hippoglobinopathies. Right, Joel? Hemoglobinopathies.
I
That
think hemoglobinopathies or sickle cell screening.
right.
Yeah, that was a difficult one.
That's a really long word. Or, or sickle cell screenings for newborns, hepatitis B screenings for adolescents at high risk, HIV screenings for adolescents at high risk, hypothyroidism screenings for newborns, PrEP or pre-exposure prophylaxis, HIV prevention medication for HIV negative adolescents at high risk for HIV through sex or injection drug use, immunization for children from birth at age 18. Dosage recommended ages and recommended populations vary. Chickenpox, diphtheria, tinnitus, pertussis, Haemophilus influenza type B, hepatitis A, hepatitis B, human papillomavirus or HPV, inactive beta poliovirus, influenza, measles, meningococcal, mumps, pneumococcal, rubella, rotavirus. Rotavirus, medical terms, I am not good at. Lead screening for children at risk for exposure, obesity screenings, counseling, oral health risk for young children at 6 months to 6 years. And here's another word, phenylketonuria, Jewel. Phen, phen,
uh, the acronym for it is PKU.
yeah,
PKU screenings.
it's
Phenylketonuria.
yeah, phenylketonuria, yeah, yeah. Screening for newborns, sexually transmitted infections, STI prevention counseling and screening for adolescents at higher risk, tuberculin testing for children at risk of tuberculosis, ages 0 to 11 months, 1 to 4 years, 5 to 10 years, 11 to 14 years, and 15 to 17 years. Vision screenings for all children, well baby and well child visits.
And a few more of the screenings for or preventive screenings for women include, again, that breast cancer mammography screening. You can do this every 2 years if you're a woman who's 50 years and older, as recommended by a provider for women who are 40 to 49 or women at high risk for breast cancer. So, again, if it runs in your family. There's also breast cancer chemoprevention counseling for women at higher risk, cervical cancer screening, also known as the Pap test, or a Pap smear for women who are ages 21 to 65, chlamydia infection screening for younger women and other women and people at higher risk, diabetes screening for women with a history of gestational diabetes who aren't currently pregnant and who haven't been diagnosed with type 2 diabetes before. There's also domestic and interpersonal violence screening and counseling for all women, gonorrhea screening for all women at higher risk, HIV screening and counseling for everyone ages 15 to 65 and other ages at increased risk. PrEP, this is a common one that we've heard a few times today, but PrEP screening, this is an HIV prevention medication for HIV negative people who are at high risk of getting HIV through sex or injection drug use. Sexually transmitted infection counseling for sexually active women and people, tobacco use screening and interventions, urinary incontinence screening for women yearly, and well woman visits to get recommended services for all women. So we gave you guys a lot of information, a lot of long lists today, but if you heard something that you recognize or heard something that you have known to be in your family, it's definitely good for you to consider going to get those preventative healthcare screenings and tests and appointments, and make sure that you are getting them as often as is recommended by your provider. But we want to thank you all for taking some time to learn about preventative healthcare as healthcare. And just, of course, because we're in multiple pandemics, we need to give some information about how to stay healthy and stay safe out there. So before we go, here's some information on COVID-19 vaccines. If you've already been vaccinated, that's awesome. You've taken a really big step in preventing yourself and your loved ones and your communities from getting sick with COVID. Multiple variants have continued to soar across the world, and it's totally understandable if you want to keep wearing your mask, especially when you're indoors, as the vaccine isn't 100% effective, and more contagious variants continue to spread. And while the vaccine won't prevent new cases of COVID from happening, it'll help keep you it'll stop you from getting very sick with COVID. It'll help keep you out of the hospital with COVID, and it'll help prevent death related to COVID. If you haven't been vaccinated and you're looking for an appointment, Whitman-Walker Health has a COVID-19 vaccine available. Please give us a call at 202-207-2480 to make an appointment. And if you're having trouble making an appointment with us, or we're just out of your region and you're a DC resident, you can visit vaccinate.dc.gov or call 1-855-363-0333. If you're a Maryland resident, visit covidlink.maryland.gov or call 1-855-634-6829. If you are a Virginia resident, visit vaccinate.virginia.gov or call 1-877-829-4682. If you haven't been vaccinated and you're not looking for an appointment, please continue to follow CDC guidelines around mask wearing, quarantining, social distancing, and the like. It's really important that you consider getting a vaccine and discuss COVID precautionary measures with people who you're around, but always be mindful of masks, keep your distance, and especially when you do not know whether that person has been vaccinated or not. And now we are also battling monkeypox and a monkeypox pandemic. So some important things to know is that monkeypox is not localized or will not only affect LGBTQ people. It's something that comes from the LGBTQ community. We did see it start to spread there first, but it's not going to stay within that community because they're not to blame for new cases of monkeypox. Anyone can get it. It's a thing it's a disease that's passed through skin to skin contact. So if you're having sex, that's an easy way to get it, which is why people are saying, be mindful of how many partners you have right now. But all that said, in DC, you can pre-register for a monkeypox vaccine appointment at dchealth.dc.gov/page/monkeypox. Again, that's dchealth.dc.gov/page/monkeypox. DC Health is also introducing walk-up vaccine locations as of today for eligible residents. So again, visit dchealth.dc.gov for more information. But you are currently eligible to be vaccinated in DC if you are a District of Columbia resident who's 18 years or older. And if you identify as gay, bisexual, or another man who is 18 and older who has sex with men or who's had multiple anonymous sexual partners in the last 14 days. If you're a trans woman or non-binary person who was assigned male at birth who has sex with men, or if you're a sex worker of any sex or gender, or if you are staff of any sex at an establishment where sex activity occurs, which would be bathhouses, saunas, sex clubs, and the like. You'll also need to provide proof of DC residence to get your vaccine. So this includes identification cards with a DC address, a utility bill or other piece of mail with your name and a DC address on it, or a current DC lease or mortgage with your name on it. All in all, be safe out there. You can get monkeypox from having an exposure to someone who has open monkeypox sores. So just be mindful of who all you're shaking hands with while you're hugging. And it might be kind of time to go back to those air high fives and air waves and air hellos and whatnot. Hi, yes, Big Shirley. If you have to be a DC resident for these DC vaccine walk-up locations, but definitely check out the vaccine.virginia.gov website and visit your local health department's website to see what their vaccine distribution process is. I think a lot of states are starting to roll out vaccines, but for certain populations of people. But yeah, wishing everyone a wonderful rest of your Friday, and thank you all so much for learning about preventative healthcare with us and COVID vaccines, of course, and now monkeypox vaccines. Have a great rest of your day. Big Shirley, Whitman-Walker, I think DC Health, like the DC Health government, has the vaccine, and so I believe Walker's partnering with them. But at the end of the day, you still have to visit the local state health department's websites to get access to signing up for and registering for monkeypox vaccines. But hope that's helpful.